Good afternoon, everyone, and thank you all for joining us. My name is Kathy Roth-Duquet, and I'm CEO and co-founder of Blue Star Families. Blue Star Families is a national nonprofit dedicated to supporting active duty National Guard and Reserve veterans and their families from all ranks and services. We work to support military families while strengthening local communities. I'm joined today by my battle buddy, Matt Boren, the Executive Director of ADC. Welcome, Matt. To kick things off, would you like to?
Kathy.
Hey, would you like to tell folks a bit about ADC and CMSI?
Yeah, absolutely. We're very proud to partner with Blue Star Families. I think the missions of ADC and Blue Star align perfectly for this type of initiative. For over 40 years, the Association of Defense Communities has been supporting the resilience of communities and states that support America's military. With nearly 300 communities, states, and regions, and affiliated industry partners, ADC represents every major defense community and state in the nation. The COVID initiative will provide resources and expertise to support communities, states, and military families throughout this crisis, including hosting events like today, a daily newsletter, and a new website that was launched just last week. The daily newsletter, I want to mention something about that. It's a perfect way for defense communities and military families to highlight how they are coming together to fight this crisis. And we need your help in finding these stories. And to briefly talk more about that, I'm going to turn things over to our editor, Leif Walcott, to explain how you or your organization can showcase stories of resilience and collaboration in your community. Leif, over to you.
Thank you, Matt, and thank you everyone who joined the call today. As we've seen the story first broke, information about the coronavirus pandemic spreads quickly, and it's easy to become overwhelmed with the amount of information developing every day. The CMSI team is working hard to report and highlight timely news affecting service members, defense communities, and military families around the United States. Most importantly, we want to tell stories of communities coming together to respond to this crisis. Whether it's a new partnership forged to aid response or community programs that are assisting a local military base or vice versa, we want to highlight how your community is responding and overcoming COVID-19. Please email myself or Randy Ford to share coronavirus news from your community. We thank you for your assistance, and I hope to hear from you soon. Back to you, Matt.
Thanks, Leif. And we'll also include your contact information in our post-event email. So I really encourage everyone who's on this webinar right now to take a look at your community and tell your good stories in the face of so much that's impacting all of us. The important work of this initiative would not be possible without the generous support of our sponsors. The initiative is powered by Booz Allen Hamilton with significant support from USAA. I also want to recognize the Bristol Myers Squibb Foundation, the Association of Military Banks of America, the Military Housing Association, Hunt Companies, JP Morgan Chase and Company, and First Command Financial for their contributions. One of the important goals of the COVID-19 Military Support Initiative is to bring together diverse groups from across the military community, local and state government, and industry to build collaboration that helps our families and communities. I know Kathy will be sharing how one segment of this initiative has been supporting this effort through White Oak Collaboration. But I also want to thank all the ADC groups and other local and state organizations that Kathy and I have been working with to make this initiative successful. Kathy, back to you.
Thank you, Matt. We know many of you have questions, first of all, for Major General Deskins, and then for our panelists who will follow. If you have a question, please submit it through the chat page on the forum. Our panelists will do their best to field as many questions as possible. Any questions that do not get addressed will be downloaded by our team. We'll get to work on those answers to the questions and get that information up on our website. Please be patient as we are navigating that through information that's frequently changing. We want to make sure we provide the most up-to-date and accurate answers, but we will get those answers up, so please come back to see them. As Matt mentioned, I wanted to share that as part of the COVID-19 Military Support Initiative, we're bringing together a group of organizations that have participated in past collaborations, often under the auspices of the White Oak conferences. That represents an informal cross-sector collaborative of leaders across government, philanthropic, and nonprofit sectors. ADC has been part of that too. In this effort, we are including corporate partners as well. The ethos of this collaborative is to look for intersectional solutions that transcend individual, organizational, or sector priorities and can be achieved through collaborative action. This mission perfectly complements our CMSI efforts. We're thrilled to have participants of the White Oak Collaborative join our work. The National Guard has participated in the White Oak Collaborative efforts for many years. We know it's important to pull together our National Guard partners to cover their efforts given the novel coronavirus outbreak. So it is my pleasure now to introduce Major General Dawn Deskins. Major General Deskins is the Director of Manpower and Personnel for the National Guard Bureau Joint Staff. Her role includes advocating for National Guard service families, members, and veterans. In this shifting landscape, Major General Deskins has been working tirelessly to address the changing needs and challenges of the National Guard. We're honored to have her with us today. Major General Deskins, broadly speaking, I wonder if you could give us an overview of what the response has been of the National Guard to the COVID-19 pandemic.
Yes, absolutely, Kathy. And thanks to you and to Matt and your teams at Blue Star Families and DefenseCommunities.org for asking me to be here today. Truly is a pleasure and my sincere honor to talk about what is my favorite subject, which is the men and women of the National Guard and what they're doing today in their communities to fight this virus. By our latest report, which was at about midnight last night, there are nearly 32,000 members of the National Guard supporting COVID-19 response efforts. This is at the direction of their state governors under various mission assignments coordinated through their state emergency managers and through the Federal Emergency Management Agency, or FEMA. Each mission is unique to that state's specific response requirements and their leadership's identified needs. 40 states, 3 territories, and the District of Columbia have approved federal funds under Title 32 status, providing their governors with great flexibility and ensuring their Guard force is cared for. The health and safety of our fellow Americans and our National Guard members is paramount to our ability to remain in this nationwide fight against COVID-19. State priorities continue to focus on expanding hospital bed capacity and providing clinical support at medical facilities, supporting community-based testing sites, and packaging, transporting, and distributing critically needed medical supplies and food. Current National Guard COVID-19 response missions include working with industry and civilian partners to satisfy demand for protective equipment used by essential staff and first responders, manufacturing, sewing, and distributing masks and other protective equipment for mission essential personnel. We're conducting force health protection assessments to ensure our Guard members are safe. And we're placing full-time, 24-hour staff at state emergency operations centers to synchronize National Guard efforts with local and state mission partners to help facilitate a unified and rapid response. We're providing mortuary affairs assistance as needed. Guard members are conducting this important mission with respect and dignity. We're supporting local law enforcement by freeing police officers to perform their duties in the communities they serve. We're conducting traffic control support and helping manage foot traffic in public spaces and community shelters. We are building and outfitting nearly 150 alternate care facilities with over 83,000 beds to alleviate stress on the medical infrastructure. We are supporting warehouse operations and logistical efforts by delivering life-saving medical equipment and critical supplies. We're delivering and distributing food in hard-hit communities and supporting food banks. We're manning call centers with a knowledgeable and calming voice. We're performing sample collections and delivery to medical personnel. We're providing support and symptom screening to testing facilities and passengers' terminals. This is not an exhaustive list, but these are some of the examples of the great work our National Guard soldiers and airmen are doing across the 54 states, territories, and the District of Columbia. I would love to give you some specific examples if you're interested in that in a follow-up question. This response is not about delivering food or support COVID testing centers. It's about protecting our children, parents, and grandparents against this virus. We know our nation is looking to the National Guard to help, and we will not let them down. Thank you for having me here today, and I look forward to further questions.
Thank you, Major General Deskins. And that's a really inspiring overview. And I think one of the opportunities that those of us who work in communities on this call have is to take that story out and tell it to the community, because it's just very motivating to hear all the things that our National Guard is doing. And even if some of us have a bit of a picture, hearing the whole thing is really, really fantastic. And so congratulations to you and to the whole Guard. I have a number of questions for you. I'd like to pass over. I know it's been foremost on many folks' minds, and we've heard this on previous town halls. Can you share any information on the recent executive action to move Guard members to a 31-day activation so that they can get access to additional benefits?
So yes, thank you. That's obviously been something that's been on the forefront of the leaders within the National Guard, their minds. The tags, adjutants general within the states ask about it often, and the chief has been really championing this to make sure that our Guard members are taken care of. So yes, the most recent presidential memorandum does allow our members to serve on continuous active duty orders for more than 30 days. And this is critically important because this is going to entitle them to comprehensive TRICARE coverage for themselves and their eligible family members. And they will also qualify for level 1 basic allowance for housing, which is a higher level than provided in orders that are shorter than 31 days in length, which is considered basic allowance for housing level 2. So as you can imagine, though, particularly in this response, the TRICARE coverage is critical. And as I have said many times, what we strive for our Guard members and for their families is benefits parity. We want our Guard members and their families to receive the same benefits when doing the same duties as their active component or other reserve component members. So we're very, very happy that we're moving in this direction for the 31-day orders.
That's very helpful. Thank you. Here's another. What efforts are states or local communities taking to support the activation of National Guard units, as well as the families they leave behind?
So again, that's a great question, and that's something we talk about quite a bit that I talk with my staff. At the state level, our family assistance personnel have been working very hard to address service member and identified family needs and fulfilling those needs through local resources that are available, to include food pantries, food distribution locations, finding companies that are hiring workers, as well as churches and other organizations that are available to offer financial assistance. In addition, we have had an outpouring from the USO, who's providing support to troops in over 23 states with care packages and food, to include mobile relief vans in areas with not a readily accessible USO presence. So that's been great to see. And at some of the local examples that we have where there's really been an outpouring at the local level is, for example, in South Dakota, the South Dakota Family Program Office has issued 2 separate resource guides to help inform families about the different resources available. Everything from financial relief to food bank info to things just to keep someone's mind mentally occupied. In Maryland, the family program has collaborated with the Maryland Blue Star families to brainstorm ideas on how to collectively provide support for our service members and families. They plan on connecting with other programs to collaborate support and create connections with the program, the units, and their families. And even some smaller efforts, but still very, very much appreciated. North Carolina volunteers are making masks for and feeding service members while they're on state active duty. In Rhode Island, National Guard retirees are volunteering to deliver groceries to National Guard families, especially those with children or whose caregivers can't get out due to no transportation. So again, not an all-inclusive list, but really an outpouring of the different things that are happening within our National Guard community.
That's terrific. And under CMSI, we're compiling some promising practices and suggestions for other organizations and communities. So we'll take your list and we'll invite other communities to share with us what you're doing that you think work well, so we can create a repository of good actions. Along those lines, what at the national level is the Bureau doing to address National Guard families' impacts of COVID-19?
Yeah, so there's a couple things that we're working on specifically to make sure that we're addressing some of the concerns. Two big areas of concern that came up from our Guard members is a concern about them potentially not having their service members group life insurance or their TRICARE Reserve Select. So what we're talking about now is not the Guardsmen who are activated, but those who aren't activated and have had their drill periods and the pay that they would normally get postponed from that has been postponed. So that's a real stress on them that they're not drilling and not receiving that pay in many instances. We're looking at ways to allow them to continue to drill in a more virtual environment, but specific to the service members group life insurance coverage, under existing policy, reserve component members do not lose coverage due to non-payment of premiums when they do not receive active duty or inactive duty pay. So that's critically important because we want to make sure that they continue to have that benefit and they don't lose that benefit just because they're not drilling. Another area is the TRICARE Reserve Select Health Plan. That's something that's available for purchase by qualified members of the Selective Reserve. Since the members must pay monthly premiums that represent 28% of the cost of the coverage by law, TRS premiums cannot be waived. However, we have worked on the policy side through OSD so that if members do not make payments, the contractor will not cease their coverage. They will give them up to 90 days post-crisis, as that's determined once this all ends. So those are two critical things that we look at. That's just two areas. Overall, we're always looking at collectively and collaboratively at stressors that are impacting our Guard members and our Guard families and making sure that we address those.
That's terrific. And I know we hear quite a lot about concern around support during inactive periods, since the Guard is active so often that losing benefits when they're inactive can be a challenge. I appreciate those comments. This one may overlap. If it does, we can go on to the next one. What are some of the unique stressors National Guard families faced pre-pandemic? And what has the Bureau done to mitigate the impact of COVID-19 on these pre-existing pain points?
Yeah, so as all families, National Guard families face similar stressors to their civilian counterparts, unless they're activated, as they are now for a state mission, or maybe if they're deployed for a federal mission. So this includes all those, balancing civilian employment and school, National Guard and military and family responsibilities, financial challenges related to underemployment or emergencies, and of course, family relations stressors. So our Family Assistance Center personnel track the contacts they receive from our families throughout the year. And the top items for the past few years have been relationships, finance, and benefits. So our state family program office in each state, through a network of Family Assistance Center locations around the state, provide information, resources, and education to assist service members and families address normal stressors and those increased by job loss, financial uncertainty, and health fears, which certainly many of our Guard members and their families are going through now during this crisis. So the resources and staffing National Guard Bureau has set the states up for success, we think, to manage this crisis. Our Family Assistance Centers are taking calls and working with community partners to fill requests for support. The chaplain's office and our resilience, risk reduction, and suicide prevention teams are proactive in communications and online offerings to mitigate relationship stressors. And the Family Readiness Support Assistants have compiled lists of county-level local resources and disseminated this information to service members and families through email newsletters and Facebook pages. Several state teams are holding training sessions, 2 training sessions per week for service members and their families with specific topics such as financial issues, operational security concerns, and how to use social media appropriately. For example, several states have a specific newsletter based on COVID-19 and this COVID-19 situation. This has turned into a weekly newsletter to include family assistance specialists, family readiness specialists, psychological health, child and youth, the list goes on. And it goes out via the Family Readiness Group and the Key Spouse Leadership at the individual units, and in a weekly update via the state family program directors. So for a state example of this, in Massachusetts, our family support personnel have collaborated with Military One Source for a weekly, what they call a TLC, which is a Talk, Learn, Connect call with the Family Readiness Group, volunteers, families, and service members. This is offered every Wednesday morning and evening with topics related to how to best cope with the COVID situation and being at home. Topics include financial, stimulus checks, employment, tips for homeschooling, and keeping kids motivated and stretching your budget. So this is just one example of one state and how they're really connecting with the resources that are available and getting them to the members in the community.
Thank you. I think we have time for maybe 2 more quick questions. One we've heard from in past town halls again. Do the various military services aid societies assist National Guard members on active duty or not on active duty? And if not, what can we do to encourage them to do so?
Sorry, I'm shuffling my papers.
Yes, sure.
I wish I had all this at the tip of my tongue, but I
Yeah.
don't.
You're doing
Yeah,
great.
so we do. So we do. We have great support from a lot of different aid societies, and we really we so appreciate that, and our family members appreciate that, particularly in these times. So at the national level, EANGUS, the Enlisted Association for National Guard U.S., along with USAA, is supporting through the Soldiers and Airmen Emergency Relief Fund associated with COVID-19, and they're supporting National Guard enlisted members. So that's one example of an aid society that is stepping up and helping out. And I'll tell you, I get calls all the time, and I know that the chief gets them directly from different organizations that have set up resources that will aid our Guard members and their families during this time of crisis. And we're always looking at opportunities to connect those aid agencies with our Guard members.
Fantastic. And then finally, for non-Title 32 members, what resources and assistance are available?
So again, for the non-Title 32, so we're talking, you're asking me about our drill status,
Yes.
our part-timers,
Yep.
if you will. Yeah, so almost all of our states have nonprofits that support our traditional soldiers and airmen with loans and grants. And again, EANGUS, in their supports all National Guard members regardless of their status. But I'd love to give you a couple of examples of some states that have really stepped up. Virginia, their Family Programs Office developed a COVID-14 resource guide that's sent out via email to service members, the Family Readiness Group, families, Facebook, and public affairs channels. And our National Guard Foundation is offering $300 grants for soldiers in financial need. So while that may not seem like a huge amount of money, $300 can make all the difference to a soldier who's really strapped in these difficult times. In Massachusetts, state and local resources are available, as well as community partners such as Mass Military Support Foundation, Massachusetts Military Friends, Massachusetts General and Red Sox Foundation or Home Base Program, Project New Hope, Clear Path, the USO, One Call Away, community groups, and the state 211 hotline. And then Pennsylvania Air National Guard has a lot of local partners. They use Operation Troop Appreciation, Heroes Supporting Heroes, Michael J. Novacell Foundation, Red Cross, Salvation Army. I mean, really, the list goes on, and that's just 3 states. So it's really wonderful, the outpouring of aid that we have to all of our airmen and soldiers, regardless of status.
Thank you. And we'll get all those resources up on our website, and we'll work with your staff to make sure we've got all the proper connections for folks.
Terrific.
So thank you so much, Major General Deskins. And I'd like to ask you and the Bureau and also any Guards folks on the town hall today to participate or to encourage others to take the CMSI Pain Point poll that we're sending out. We're collecting information on what in real time are America's military families, the service members and their families experiencing right now. Unfortunately, we have really good participation with the active duty, not enough information from the National Guard to report out, but we know we can make a difference if we get the folks on this call to take the poll, and if we could get help from the Bureau and letting people know that's out there. We'd love to share those findings with you as we have with the other military services.
We'd be happy to do that, Kathy.
Thank you. So we appreciate you so much being with us here today to represent the Guard. We had many more questions than we can get to, but we'll share them with your staff so we can get those answers up for the folks on this call. Thank you for sharing this new landscape and for continuing to support service members and their families. As this continues to go on, we'll probably reach out again and, in some time in the future to see if we can have you back if you'd be willing.
That would be great. I would be happy to do that. And I just, in closing, I would just like to foot stomp a couple things that the Chief of the National Guard Bureau has said in all of his statements. If you're going to design an ideal military force to assist with a response like COVID-19, it would be the National Guard. We are 450,000 strong in every state, territory, nearly every zip code in the country. So that means less time and distance, which means more lives saved. This is a national crisis, and every American has a role in stopping this pandemic. We know our nation is looking to the National Guard to help, and we will not let them down. Americans should know the National Guard has their backs throughout this crisis. We're in this together, and we'll get through it together. Thanks, Kathy.
Thank you. Now, for the second half of today's discussion, we wanted to bring in a panel of experts to answer questions from attendees. Further, as a reminder, to submit a question, use the chat feature on the forum. We'll pull questions from there to ask our experts. To moderate this discussion, I'm going to ask my battle buddy, Matt, to join us again to introduce the experts and field the questions from our attendees. Matt, if you could take it from here.
Thanks, Kathy. Kathy mentioned, we are very fortunate to have a well-versed group of experts that are here to answer your questions. So please keep them coming in. I see that we have several, and I'll do my best to get to all of them. And the ones that we do not get to, we'll try and get up on our website and provide some answers for folks. I just want to do some brief introductions. Our first panelist is Brian Garrett, the Deputy Director of Military Affairs for the Utah Department of Veterans and Military Affairs. We also have Erna McCrae Scalera, who's with the Maryland National Guard as a Senior Family Readiness Support Assistant. And lastly, we have Colonel Retired Mike Hadley, Legislative Programs Director for the National Guard Association of the United States. So I want to thank all of you for being here, and I think we'll just go ahead and jump right in because we've got a lot of questions to get to. There has been several questions regarding if a Guard's man or woman is an essential civilian employee, whether that be in the federal government or in the medical field. Do they still get called up.
Matt, this is Brian Garrett. I'll speak to that for just a minute. Many of the adjutants generals tend to work with the local community leaders on an almost individual basis with those folks, because you can very quickly create a rob Peter to pay Paul situation when you pull a nurse out of a local hospital to stand them up on orders. So my experience with adjutants generals, and specifically the adjutant general here in Utah, they've tried to avoid that as much as possible. Now, that said, Mike may have a different perspective. It sounds like he might have come up hot on his bike.
Thanks, Brian. No, I agree with you. I think that's something that is left up to each adjutant general, and they've got to balance the assets that they have based on the current mission requirements. So that's something that's constantly looked at and updated. And again, as Brian indicated, nobody wants to try to pull somebody out of another critical skill set in order to help out when they could be utilized in a different capacity. So it's really on a case-by-case basis that is constantly an ongoing challenge.
Thanks, guys. I appreciate that. We have a question here. If a Guard member in a state is activated, but had previously applied for unemployment benefits or was collecting unemployment benefits, do they still continue to collect those benefits while they're activated, or will that stop?
This is Brian. I'm not the expert on this. I wish our workforce services representative was handy, but I think because they have gained a form of employment, have income coming in, it could offset that. And I would just suggest that in that case, those guardsmen need to work with the local entity at the state that manages the unemployment insurance program.
Mike, have you seen that been bubbling up on the Hill, the question surrounding that?
No, we haven't had that. We haven't encountered that yet. Usually, you know, our membership is pretty good about reaching out to us when they have a particular issue along those lines and letting us know whether or not it's a concern. And we have not had that one come up yet, but that's a great one that I'm going to take as a due out to kind of look into and be prepared to deal with that as it comes up, though.
One question, and Erna, this might be for you. What steps are the National Guard in the different states taking to protect both guardsmen and their dependents from COVID? And are they being given priority for testing, or what's the status there?
Matt, I'm not an expert on this subject particularly. However, I do know that Maryland National Guard has shared patterns on how to make your own masks and encouraging everybody to wear masks. They've reached out to volunteers to have masks made and donated, and the volunteers have had an incredible response from both Air and Army side. They are doing their best to ensure that the soldiers that are infected are taken care of, and that they're making sure that everyone is social distancing and staying safe from each other and following the guidelines that have been put forth by the governor.
Thank you. I appreciate that. Brian, I think you may have a chance to weigh in this particular question. A lot of guardsmen are actually also small business owners. And so when they are activated, are there any special circumstances here that apply when guardsmen get activated because of COVID, or is it the same as if a guardsman was activated to say, deployed to Iraq or Afghanistan?
I think there's a combination of both. The guardsman that owns a business, and we see a large number of them actually that own businesses. There are some protections out there. Some of the states vary on what those protections offer. With regard to the COVID, they would be entitled to the many benefits that are coming fast and furious from the SBA with the help of the Chambers of Commerce to offer relief to those businesses. So while they're not military or COVID specific, there are a great deal of benefits out there that the veteran business owners, as we call them, are eligible for. We have a Veteran Business Resource Center in Utah that, recognizing the number of guardsmen and reservists that own businesses, really leaned into the what we were seeing with businesses being shut down, and got very aggressive in their training opportunities, their counseling opportunities, and the resources that they're providing. And I think you're seeing that across the SBA offices across the country as well.
Thanks, Brian. Erna, Mike, any thoughts on that particular question?
No, I was going to just say I don't really have anything else to add beyond what Brian already indicated on that. I think he was spot on with with what he was saying.
No, I also agree with Brian right there.
Okay, thank you. One concern that folks have is, do you think we'll see an increase in USERRA claims as guardsmen come back and the economy shrinks and unemployment grows? Do you foresee a growth in claims for unemployed guardsmen?
I agree. I think that is a major concern. It's something that we're watching very carefully. I think that it only kind of stands to reason that they're going to be susceptible to that, particularly as a lot of businesses are laying people off nationally. So, we're working closely with the SGR right now to ensure that, guardsmen are taken care of and not taken advantage of under USERRA laws.
Matt, the National Guard also has programs, for example, Citizen Soldier for Life. He has also mentioned ESGR and personal finance counselors that are available not only to the soldiers, but also to the family members and the family assistant specialists. And we're all working together to make sure that we're getting information out there on how to find a job, how resume workshops, and making sure that our soldiers are informed on keeping their jobs and then how to get new ones if they do end up losing their jobs.
Thanks, all. This one kind of dovetails into a town hall we'll be putting on next week that focuses on basic needs and security. We're getting some questions here about families that have been struck by unemployment because of COVID and have been called up to serve, and the spouse and the family are back home, and they may not be getting paid enough to support their needs. Are states like Utah and Maryland taking steps to address that very kind of specific need?
Erna, I'll let you go first and then I'll follow you.
Okay, very good. We are making sure that we have the public health briefings and safety briefings on a daily basis. We're also sending emails out about COVID-19. Our family assistance specialists are calling the family members of each activated soldier to check on their well-being and to check to make sure that they are doing well and staying healthy, and if there are needs, that these needs are being addressed as quickly and as efficiently as possible, utilizing every resource that we have in our family programs and making sure that the soldier family member has access to these services.
So in Utah, we recognized early on that as the businesses were going to be able to be closing, we were going to see some significant impacts on our guardsmen and reservists. And in many cases, we've seen what we've started to call the trifecta, where the drill pay has been pushed, the member lost their job, and the spouse lost their job. And I think there was a question on this earlier. Unlike our active duty counterparts, I'm a guardsman, by the way, but unlike our active duty counterparts, Guard and Reserve don't receive the same benefits from, say, the Air Force Aid Society. They only support the active duty in particular, unless of course, Guardmen or Reservists on active duty. So we coordinated with our Utah Guard Charitable Trust and then Utah Defense Alliance. Utah Defense Alliance is a longstanding member and partner of ADC to raise about $35,000 in a hard commitment, and we have a soft commitment for more to be able to go out and purchase grocery cards that we were able to give to the family support specialists around the state, the military leadership around the state, so that when a service member or spouse came in and needed to put food on the table or gas in the car, they were able to go get what they need from the store. Many of the organizations have pantries. The pantries kind of got raided a little bit. The thing we found with the gift cards is if they're a Coke family, they can go buy Coke or they can buy Pepsi, whatever their preference is. And it really serves to buy them some relief in this. And we've moved through quite a few of those cards, but we're postured to buy more if we need to be able to just keep food on the table.
Oh, one thing I did want to add, our units have been notified that if they have soldiers that can't be on orders right now, they can be demobilized for hardships. Also, those who have small businesses and are the sole provider for family and et cetera.
Thank you. No, that was very informative. Oh, sorry, did somebody have something else to add? Maybe I just heard some background noise there. Mike, this question is specifically for you. Has NAUGUS, the National Guard Association, changed any of its policy advocacy priorities in light of this? And if so, can you talk a bit about what you're going to be looking for when you advocate for new support for the Guard on the Hill?
Sure. Yeah, we had to take a kind of a hard pivot with the coronavirus. Obviously, General Deskins did a great job of kind of laying out some of the issues associated with Title 32 and getting them onto 31 days. That was one of our first big initial initiatives that we took on, was to ensure that we did get Guardsmen onto 31 days or beyond orders, so that they would get their TRICARE benefits associated with that. So that was the first major hurdle that we were trying to work towards. Then beyond that, we want to make sure that think ahead a little bit. We want to start looking at whether or not, we want to make sure that they've got adequate medical coverage on the back end of this, is that they have to go into, quarantine on the, for 14 days when they come off those orders, what that's going to look like and what the plan is for that. And then also, even beyond that, whether or not that they're going to be eligible for transitional medical coverage is the same ways that they would coming off of a deployment. Now, some of the current laws and policies associated with that leave it a little bit open for interpretation on that. So we're trying to push this, to be looked at as it would be for a deployment. So again, that's something that we're going to be focused on going forward with, probably for the next 90 days and beyond, to try to help our Guardsmen, because again, we're really focused right now on the medical aspects of this and ensuring that they've got proper medical coverage from a force protection standpoint. So anyway, that's kind of what we're working on right now.
Thanks, Mike. One question, and I think Brian and Erna, you can help me, and Mike, you may have some insight into this as well. It's only been, I guess, a month and a half really since this became on the national scene. and the Guard started to become activated and engaged in the COVID crisis. But have you begun to see trends already that military families might be facing, or that service members are talking about, that are kind of bubbling to the surface?
One thing, Matt, some of the things that we have seen are concerns over food with the pantries being closed. A lot of the pantries in our area have been closed, and the fees for having the food delivered are high, especially with financial issues and some folks who are losing their jobs or at risk for losing their jobs. We're seeing a little bit of childcare issues. For example, the grandparents were watching the child, and now the children can't go over to the grandparents' house. So there's some concerns with childcare. But all in all, I think our military families are maintaining their resiliency and supporting their soldier while the soldier is activated, and doing the best that they can with their situation as it is.
In Utah, our department did a survey, and it's still an active survey, but we did a data poll yesterday. And the survey went out to our military veterans, Guard and Reserve, and we were able to extract the Guard and Reserve data. And some of the early numbers we're seeing, and we're still digging at these, but just of interest, of the Guardsmen and Reservists that answered when we asked a question about has their employment been affected, 20% said they have had no impact in their employment. 10% experienced a decrease in hours. Interestingly enough, 13% experienced an increase in hours. We kind of didn't expect that one. And about 6% have been laid off or unemployed. And as we dug into the unemployed, only about 14% have applied for unemployment. 45% came back and said that they didn't intend to apply for unemployment. We've also seen, we asked a question about finances, and roughly 6% of the respondents said they were unable to pay their bills. The percentage of that needed help with their business, others needed help with employment, others needed help with financial assistance, paying rent, mortgage, utilities, and groceries. And then the last question we asked was if the COVID virus had had an effect on the mental health of their family. 37% felt that their family's mental health had been affected. 47% felt there was no effect on their family's mental health. And then 37% are taking active measures to mitigate the effect of mental health on their family. So we're still digging at these numbers, but it validated some of the assumptions that we made and some of our early concerns about keeping food on the table, gas in the cars, and assisting with unemployment. And as I told Kathy, as we finalize these numbers and finalize this survey, we'll be sharing it with our local Blue Star Families chapter to do some comparative analysis between the two organizations.
Thanks, Brian. One question is, we're getting a couple of them actually, and they relate to childcare. Apparently in two income households, and one parent was kind of the primary caregiver for the children, but they have gotten now called up for active service, putting a real strain on the guardsman's spouse. Are in Utah or Maryland or even nationally, Mike, are you seeing the state step up when it comes to child care and provide any special programs to assist these folks?
We have not been directly involved with any child care issues, and nor have we had anybody from our membership bring that up as an issue as well. So I really can't really speak to that issue.
We've been providing resources along the lines of military childcare.org and other resources that can help soldiers who are activated find childcare relief. We've also, our child and youth program has been very, very active, and it's the month of the military child. So we have virtual resources to help keep school-age children busy. So the other than that, I mean, we don't have any other childcare available for family members. We're just trying to find you know, them resources that they can go out into the community and find.
Here in Utah, we don't have a specific resource for the Garden Reserve. However, the state launched a new program the end of March that they called One Utah Child Care. And the purpose of this program was to provide childcare using a task force approach to meet the needs of essential employees across the state. So it's not Guard Reserve specific, but because of the nature of the work that they do, it's a resource that they can take advantage of if they needed to.
This question may be kind of tricky, but I'm seeing a lot of concern that their guardsmen and women are getting mixed messages when it comes to PPE when they're doing their duty. It sometimes are being told to wear masks all the time, but then in some states you don't have to wear it. Are you following national guidance, or is that state by state?
I believe that that's being handled, you know, at the local level, you know, with normal risk assessment that, you know, each of the, you know, tags and local commanders are taken into account. You know, certainly there's national guidelines and policies that are being put out, but I think it's largely being left up to again, handled at the local and state level as to what level of PPE is adequate for the specific missions that individual guardsmen and units are being asked to perform.
Go ahead, Erna.
In Maryland, we are following the governor's guidance, so through the state, and ensuring the safety of our soldiers by following the state guidance.
Our office gets updates from our military organizations in Utah daily, and by and large, they're following the guidance of the governor's Stay Safe initiative here in Utah. And that guidance is usually pretty consistent with the guidance that DoD is sending out. Interestingly enough, our survey, though, we found that half of the respondents didn't know if their local community was under any type of public health order or not. We found that a little bit concerning that they wouldn't know that.
Brian and Erna, I think this one's for you. To have, with food assistance and some of these other basic needs being such a priority in some of these polls we're seeing, are there any good examples in your states of a community and a unit partnering to provide some of these essential services?
Erna, I'm letting you go first.
In Maryland, the Guard is partnering with some of the local organizations and the food pantries to help disperse the food out to residents in some of the areas where that's more needed. Sorry, lost my train of thought. So they're supporting the food pantries, and with our family assistance specialists, the wellness checks, we're making sure that the family members are receiving food and services that they need. So we're given missions to prepare and deliver the food as needed.
And on our side, in addition to what I mentioned about the food cards earlier through our two local community organizations, our Department of Workforce Services is working directly with our Guard and Reserve units on an employment initiative that, as the unit identifies members that are in need of employment assistance, the Department of Workforce Services is proactively calling the members to identify what services they need, help them get pointed in the right direction to get signed up for the services, engaging them. We have a virtual town hall that I think is going on right now to plug those folks into. And Workforce Services has really taken a broad approach to it, to the point that the live-in boyfriend of one of the service members lost a job, and they reached out to him and got him the resources that he needed to get set up for unemployment and register to search for jobs.
Thanks, that's great information. We're about to run out of time, so I wanted to ask one last question to the group, and Mike, we can start with you. If there's one important thing that you want to say today that you haven't been able to, what are you seeing, and what do you think we all need to be thinking about and preparing for as this crisis continues?
I think that it's probably going to continue to evolve. I think that they're probably going to see an increase in number and participation of guardsmen that are out there, and I think that that's largely going unnoticed nationally, at least from what I see in the national news media. And again, there seems to be, again, just not enough focus and emphasis on that. But please realize that the Guard is out there in all the 54 states and territories, trying to help keep our communities safe and doing whatever they can and doing whatever's asked of them. So again, we're focused on trying to do at the very least that we can to keep them safe, so that they can do their job.
Thanks. Brian, any last thoughts?
I think just to build on what Mike mentioned, I think this is, a marathon versus a sprint, and it's going to take all of the community partners to continue to rally for the long term around our guardsmen and reservists, because we simply don't know, as we return back to whatever normal looks like, the impact on employment with these folks. And the civilian employment is such a key in that three-legged stool we talk about with the guardsmen and reservists, that we've got to stay focused on that and continue as communities to be innovative and look for creative resources to help those folks be successful. Because we believe, and I think it's a pretty fair statement, having that in place and taking care of that civilian employment aspect supports the overall readiness of the guardsmen or the reservists, which better allows them to support their mission. And I'd be remiss with Kathy and McCall if we didn't give a shout out to the great work that Blue Star Families is doing, working with the spouses in particular, in helping to address the previous issues we were having with spouses before COVID, but Blue Star's ability to adapt in the environment we're in and recognize that changing environment to help our spouses.
Thanks, Brian. Erna?
Our mission is people first, soldiers, families, civilians, and keep everybody safe and as best prepared as possible to get through this pandemic. Our goal, of course, would be to survive mentally and emotionally, financially. We're making sure that our essential staff stays healthy as well, following the governor's guidelines. We're going to continue to partner with resources and programs both locally and throughout the country, like Blue Star Families. We're creating trainings, virtual trainings to facilitate to the families and soldiers to help them be successful. And I believe that our families are going to remain resilient as we proceed through this, and like Brian said, our new normal
Thank you. I really want to thank all three of you. It's not easy to sit on the hot seat, if you will, and answer questions when information is evolving by the second. So I really appreciate your willingness to be here. This conversation, of course, will continue over the following weeks and months. And as we get more information, hopefully we can get everybody back together again. For the attendees, we'll have the questions that we weren't able to get to up on the website, and we'll attempt to answer those as best we can. So with that, I'd like to thank everyone again, and I'll turn it back to Kathy.
Thanks, Matt, and thanks also to Brian, Erna, and Mike. What a really great conversation. Also want to thank Major General Don Deskins, but Brian, Mike, and Erna, I hope you'll help us with pushing out our pain point poll so we can get more of those updates to share with you and our participants, our audience as well. We greatly appreciate the work that all of you and Major General Don Deskins is doing for the National Guard families and for sharing your knowledge with us today. I want to remind everyone attending to please check your email following this town hall. You'll be receiving a follow-up information, including a post-webinar survey that helps us pick our next themes to focus on. Your input is absolutely necessary. And again, that pain points poll will be in your email. Please take it and please share it with your contacts. Finally, please join us next Tuesday, April 21st, for our Basic Needs Security Town Hall, organized by our friends at NMFA and including Mrs. Laura Heighton, spouse of the Vice Chief of the Joint Chiefs of Staff. We'll be discussing the increased challenges around food and housing, particularly regarding stop movement orders in light of COVID-19. And on Thursday, April 23rd, we'll be hosting the psychological toll of COVID-19 on Military Families Town Hall. This mental health has been the #1 town hall topic requested in these follow-on surveys, so we're very pleased to deliver this. This town hall is organized by our friends at the Cohen Veterans Network and Psych Armor Institute. In the meantime, please check out our new website, which is full of resources, the answers to these questions, and partner resources coming next week. This is designed to help you, your family, and your business during this difficult time. Thanks again for joining us today. We look forward to welcoming you at a future webinar. Take care, everyone. Goodbye.